Welcome to Student Health Services. My name is Nancy Ramirez, and I am a registered nurse. I am here with Carmita Velis, who is also a registered nurse. Today we will be explaining how we can help you meet the requirements for your health science program.
In this orientation presentation, we will be covering the following important items: location of student health services, making appointments, health science program orientation form, health science program health requirements form, student worksheet, health science program clearance checklist form. This includes TB clearance, measles, mumps, rubella, MMR, and varicella, chickenpox clearance. Hepatitis B requirements, Tdap, tetanus, diphtheria, and pertussis, annual influenza vaccine flu shot, and physical exam. All of the forms discussed in this presentation should have been emailed to you by the coordinator for your respective program. If you have not received your forms, please contact your program coordinator or designee.
Student Health Services is located on the main campus in D105. Our phone number for appointments is 626-585-7244. For hours of operation, please check our website at www.pasadena.edu/health services.
You can meet the health requirements for your program either through Student Health Services or at your primary physician's office, PMD. We strongly recommend that you call as soon as possible to schedule your first appointment, as you are competing for appointments with other health science program students. You may need up to 4 appointments over a 2-week span. Please bring a photo ID or your 8-digit student ID card to all appointments. For accepted or prospective students not currently enrolled, an administrative health fee will be charged. If you are having your health clearance at your primary physician's office, consider scheduling an appointment with Student Health Services prior to your doctor's visit to determine which tests and/or vaccines are needed.
The first form we will talk about is the Health Sciences Program's orientation form. This form includes the price list for vaccines, laboratory costs for tests you may need, the costs of TB clearance and physical exams, the number of appointments that you may need for completion, practice for self-efficacy. We accept cash, credit, debit cards. Please note, we do not accept American Express or checks. For your information, Student Health Services does not bill private health insurances. Also note, all prices are subject to change.
The next form is the 2-page Health Sciences Program's Health Requirements form. This is the form that clinicians will complete and you will turn in to your program in order to meet the health requirements.
Important: only clinicians may document on this form. Some of the health sciences programs have slightly different requirements from others. These will be highlighted during your appointment. For example, the anesthesia tech program requires additional lab testing. You will be asked to sign the consent for release of information on the second page. This allows your program to speak with Student Health Services regarding only the information on this form. If you are choosing to have your primary physician complete your health requirements, please have them document according to the guidelines on the form. Most common errors made by PMDs on this form are not ordering or documenting quantitative labs, not dating the physical exam, and not placing a clinic or office stamp on the physical exam page.
The Health Sciences Program Clearance Checklist is your worksheet and guide in completing all the requirements for health program clearances. We strongly recommend following the order of these steps when seeing your own medical health provider. Please bring all your immunization records and supporting documentation, which can include childhood immunization records, military vaccine records, school immunization records, hospital or urgent care record of Tdap vaccine.
For tuberculosis or TB clearance, you must meet one of the 3 following requirements: a 2-step TB skin test, have 2 negative skin tests at least 1 week apart. We can accept tests within 1 year of program start date. TB test documentation must include the number of millimeters of induration. Or, if you have a history of a positive TB skin test, bring written documentation of the positive TB skin test and documentation of a negative chest X-ray done within the past 6 months. If you have no documentation, either a TB skin test or an IGRA quantiferon gold blood test will need to be done. Or a quantiferon gold IGRA blood test. Documentation of a negative IGRA blood test done within 1 year of the program start date can be accepted. If needed, the blood test can be ordered at Student Health Services and is done at Quest Labs. Very important. TB clearance must be completed prior to the administration of a live vaccine, either MMR or varicella chickenpox vaccines. There are currently 2 programs that require only 1 TB test at this time. This is subject to change.
For MMR and varicella clearance, you must meet one of 2 possible requirements. Have a record of 2 documented doses of each vaccine. The first vaccine must be on or after the first birthday and the second vaccine given at least 28 days later. Or have documented blood titer for measles, mumps, rubella, and varicella. The laboratory blood titer results must be a quantitative value, meaning the results must be a number, and there must be a documented reference range. There is an example of an acceptable titer result on this slide. If measles, mumps, rubella, and varicella vaccines are needed, they both must be given on the same day. These live vaccines are contraindicated in pregnant females. If needed, discuss with your NP or MD.
Hepatitis B clearance is based on the CDC guidelines for the healthcare professional, published December 2013. The requirements are: you must have 3 documented, appropriately spaced hepatitis B vaccines, and a positive quantitative numeric blood titer for hepatitis B, which is drawn after a completed series. If you do not have written documentation of 3 hepatitis B vaccines, you can start the series of vaccines prior to starting the program and complete the series while attending the program. For all questions regarding vaccines, please consult the Student Health Services nurse during your appointment.
Additional vaccines required are a Tdap vaccine, which is 1 time only, and a current annual seasonal influenza vaccine. The documentation must include a lot number and expiration date. The final requirement is the physical exam. Physical exams may be scheduled at Student Health Services for a low-cost fee once all other requirements are completed, or the physical exam may be scheduled with your primary care physician's office.
In conclusion, all required vaccines are available at Student Health Services for a low cost. When scheduling an appointment at Student Health Services, please allow enough time to answer the questions the front office staff will ask in order to schedule your appointments appropriately. We also ask that you are courteous with them as they assist you. Should you need to cancel or change an appointment, please call us. If your primary physician has completed your health clearance, we encourage you to make an appointment with Student Health Services to review your paperwork prior to submission to the program. We also recommend that you scan and store all your immunization records using a scanning app such as TurboScan or CAM Scanner. This way, you can have easy access to this important information at any time. We are here to help you as you embark on your program journey. Thank you.